How biofilm, how to treat and prevent its recurrence. This lecture is going to be presented by very own, my friend, philosopher, guide, Dr. Suresh Shottam. He's a practicing clinician, researcher, de-addiction therapist, author, speaker, lecturer, who has worked extensively in the United States for 30 years. He has been involved in the field of wellness and integrative medicine for last 25 years. His knowledge on biophysics has helped immensely to give lot of treatment for oncology also. So let's hear from Dr. Suresh Shottam on biofilm and how to treat biofilm. And what do we need to know about biofilm, because we all have it. Okay, before, of course, there is lunch pending, but till the time we don't finish lectures, before lunch, we are not taking a break. So I regret it is getting postponed, but I can't help it. Sorry, and thank you for understanding. The choice can be, but I don't want to disturb the whole flow, so that's why. Thank you. And Dr. Renu, of course, next is Dr. Renu, so you'll better wait.
So if everyone's hungry, are they going to be listening?
Of course they will listen.
Hello? Yeah.
Actually, at fasting state, Dr. Pradeep just said, you are more focused and alert. So this is a fasting
In the fasting stage, huh? We're going to be more focused.
Wherever he is, but I'm just taking that liberty.
I should start, huh? Oh, I'm supposed to start. So how do we start? Good afternoon, everybody. I hope everyone is hungry. Yeah? Okay, so we're going to talk about biofilm. The first thing we need to know is, I'm sure everybody who's been in clinical practice for any length of time, you would have come across patients with infections who don't respond to any treatment. Anybody? Yeah. Or how about infections that you treat them and the infection goes away only to return with a vengeance? Anybody? Okay. What about those of you who treat cancer patients, especially those with solid tumors, and you see the tumor starting to fungate and oozing and causing a lot of pain and fever and everything for the patient? Have you experienced that? In all these cases, any treatment that you may do will fail because one of the main aspects that causes these conditions is being ignored. And that is, biofilm is involved in all these cases. So what is biofilm and how is it involved and why does it cause such problems? Okay, so before we get into what biofilm is, just want you to know one thing. I'm going to be referring to bacteria and antibiotics as the treatment. But when I'm doing that just to make it a little easier to move quickly. When I say bacteria and when I say antibiotics, I'm actually talking about not only bacteria, but parasites, fungi, mycoplasma and things like that. When I say antibiotics, I'm talking about antiparasitics, I'm talking about antifungal treatments and all those things. Okay, so just keep that in mind. 80% of all infections are related to biofilm. And unless it's treated, the treatment will be moderately successful or not successful at all. So some of these things are like H. pylori, Borrelia, Yersinia, which is involved in autoimmune disorders of the thyroid, such as Hashimoto's or Graves' disease. Then E. coli, Klebsiella, Mycoplasma, Candida yeast infections, all these things form biofilms. So what is biofilm? Okay, so see, when we treat patients with antibiotics, antiparasitic, and all that, we are assuming that these are organisms that are just floating around in the body by themselves. So we call that planktonic. So bacteria and things like that do not float around in isolation in planktonic functions. They form communities. So we call that sessile communities. So they all crowd together and make a home for themselves. That home is called biofilm. Okay, so the biofilm shields them. They live below the biofilm and they are shielded from the immune system. They become invisible to the immune system because of the protection that the biofilm offers them. And that's why treatments do not work that well, because they cannot penetrate the biofilm. So what is biofilm? It is basically a layer of polysaccharides. Okay, the bacteria first adhere to the surface of the tissues, then they generate a polysaccharide matrix. They start stealing from the body minerals like calcium and magnesium and iron and whatever is available. Within the biofilm, the bacteria share among themselves. They share nutrients and their DNA and everything, and they start changing from one form to another to resist the immune system. Where we went wrong was to buy into the germ theory of Louis Pasteur, which talks about monomorphism, which is a bacterium is always a bacterium, a virus is always a virus. It's not like that. They can morph to evade the immune system. So that's what they do while they're protected behind the biofilm. They keep changing forms. Okay, so within the biofilm, while they undergo changes, they evade the immune system. Because they require less oxygen and less nutrients, they're more or less like in a dormant stage. So it's very difficult for the immune system to even detect them. And they resist the treatment from antibiotics, antivirals, and stuff like that. In addition, biofilms form a physical barrier that keeps most immune cells from detecting the pathogenic bacteria. See, the current model assumes that these pathogens are floating around by themselves in the body. It does not recognize that they live in communities. Okay, more than 80% of the bacteria are hidden in biofilm communities. So, treating illnesses associated with biofilms with antibiotics or antimicrobials and stuff like that is like buying a lottery ticket. You can get some response, but usually it is not optimal and usually it recurs. For example, irritable bowel disease. Antibiotics will work at first, followed by a rebound due to the bacteria evading the antibiotic. So, where do these biofilms exist? When you undergo an endoscopic procedure, okay, vascular grafts, medical implants, dental prosthetics, severe dermal wounds, exposed wounds, such as in solid tumors in cancer, for example, or non-healing ulcers in diabetics. Okay, the GI tract is a good environment for biofilms because it has a huge surface, it gets a lot of nutrients coming in, and it's warm and moist and damp. Great environment for forming biofilms. So most of us, to some extent or the other, have biofilm growing in our gut. The second most common place is the nasal passage, so rhinosinusitis and things like that. Third is the throat, where you get strep throat and stuff like that. So these are all the, main areas. But biofilm can exist anywhere, in the intestines, inside the endocrine system. Okay, so biofilms are very difficult to diagnose because the bacteria within the biofilm are tucked away in the biofilm matrix. So swabs and cultures show up negative. Even though the bacteria are there, the swab and the culture report will come out negative. Okay, stool samples usually do not contain the biofilm bacteria. Biofilm samples within the GI tract are difficult to obtain unless you use an endoscope, and also you need to know where the biofilm is actually located in order to get a sample. But even, let's say, you can get the sample may still test negative because the microbes adopt to a lower nutritional level and rendering normal cultural techniques useless. So it's very difficult through these traditional processes to diagnose the presence of microbes which live in a biofilm community. There's another problem. Biofilms are not only bad communities, they can also be good communities. In the gut, for example. And it's very difficult to tell the difference between the two. So, one emerging technique is to look for microbes in the urine, but that technology still hasn't been perfected and still not available. But that would be one way to diagnose biofilms, which should be in the near future. Mineral deficiencies are common in people with biofilm, but there are other reasons for mineral deficiencies, so you cannot rely on mineral deficiency as a diagnostic tool for biofilms. Biofilms are implicated in many, many diseases. Up to 1/3 of the patients with strep throat caused by pyogenes do not respond to antibiotics. In one study, there are 99 different varieties of strep throat causing bacteria isolates which form biofilms. 10 to 20% of people infected with Lyme disease. You don't see much Lyme in India, but in the United States, for example, we see a lot of Lyme disease conditions, and they are extremely difficult to treat. And one of the reasons is because of not treating the biofilm. Lupus flare-ups are induced by infection, inflammation, and trauma. And in this autoimmune disease, cell death by a process called netosis instead of apoptosis turns the immune system against itself. I want to talk a little bit about netosis because it is something that's implicated in many, many conditions where infection is at the root, including cancer. So, in netosis, the neutrophils spill out from the cell cytoplasm into the extracellular fluid. These things called chromatins, and cellular debris and stuff like that. So once they spill out, what happens is that whole area becomes a ripe environment for a new biofilm community to form. So you start getting more and more biofilms by treating the actual infection. I hope that makes sense. Okay, so netosis is a condition where cells are destroyed as a result of the treatment. In cancer, for example, chemotherapy or radiation, or in cases of infection, antibiotics, antipyretics, and stuff like that. So when these cells get destroyed, they spill out an enzyme called chromatin into the extracellular fluid. So once these things, protein debris and cellular things start, NET stands for neutrophil endothelial trap. So when these neutrophils spill out, they create a trap. And in that trap, a new biofilm forms. So the more you treat, the more biofilms you're creating. So a little later, we'll talk about how to avoid this vicious cycle. In a sense, if you first treat the biofilm and destroy it, then the process of netosis reduces. So you're not creating new biofilms as a result of your treatment. Same thing happens with chemotherapy, for example. The more cells you kill, you're creating a new generation of daughter cells because the cells that escape the chemotherapy are actually feeding off the cellular debris from the dying cells and creating cancer stem cells. Similar process happens in infectious etiologies. Okay, for example, chronic rhinosinusitis. Topical antibacterial and antifungal agents show no benefit over placebo. So, and that is because the biofilm is preventing the topical agent from actually penetrating the biofilm and getting to the pathogens. Okay, antibiotic treatment in irritable bowel disease can work for a time, but flare-ups happen. So this is where in autoimmune conditions, anybody who's used to treating autoimmune disorders, one of the most frustrating experiences you'll have is, for a while the treatment appears to be effective, and then for no obvious reason there's a flare-up. And when the flare-up happens, you don't know what to do. You're trying to avoid going back to the steroids and all that stuff, but then to get the patient out of trouble, you got to do it. So you're back in the vicious cycle again. The reason is biofilm. Okay, you will notice once you learn how to treat the biofilm as the first line of treatment before doing other things, the incidence of flare-ups in autoimmune disorders will drastically go down, and they'll be fairly mild compared to what normally happens. You know, conditions like psoriasis and Hashimoto's and things like that. Okay, so far clear? Okay, so there's a link between autism and biofilms. And why is that? Anybody? Huh? See, when you treat autistic patients to disrupt the biofilm, what happens is the heavy metals that are lodged in the biofilm. Remember, when the biofilm is formed, the pathogens are stealing nutrition from the body. So what are the nutrients they're stealing? Calcium, magnesium. These are known as the soft metals, right? Which means they also steal whatever else is available, like iron and mercury and things like that. So biofilm is loaded with heavy metals. So when you treat and you disrupt the biofilm, one of the things that happens is you start distributing these heavy metals that are contained within the thing. So that needs to be dealt with. And if you don't do that, like in autistic children, for example, the bacteria aren't choosy because they choose these things. So you're actually redistributing what was stuck in the biofilm around the body. So they may develop new symptoms, and it will appear like the treatment is not working, but actually it has worked very well. Does that make sense? Okay. So you see where it's going? So here comes the big, what should I say? Blinding light of enlightenment. What to do about this, right? She's saying, get on with it, what to do about it. The answer. See, this is the problem. If you don't understand the stuff and just follow the answer, you will not be able to customize. Yeah. No, see, the answers are not that difficult. The problem is, if you understand the principles on why it's happening, you'll be able to customize it for each patient rather than blindly following a protocol. Very often, patients who come to us for treatment, they say, doctor, what is the protocol? And I tell them there is no protocol. And if there was a protocol, you wouldn't want it because it's not going to give you the best results. Okay, so how to treat biofilms. Okay, antibiotics and more antibiotics for IBD, corticosteroids for chronic rhinosinusitis. Is that how we do it? Okay, so there's a far better way. First step is to break down the biofilm. Once you break the biofilm, you're removing the barrier that's protecting the pathogens. Then you attack the pathogens. But it doesn't end there. See, right now, what are we doing? We're just attacking the pathogens. And we're not getting to them because they're protected by the biofilm. So what we're going to do now is a little bit different. We're first going to remove the barrier, remove their defense, then attack them. But once you attack them, the story doesn't end there. You need to remove the debris that they leave behind so that they don't form a new colony of biofilm. Make sense? Okay. So, there are a whole bunch of options that we can use which are biofilm disruptors. And thankfully, none of them are drug-based. Isn't that nice? So here they are. Nattokinase and lumbrokinase are very good biofilm disruptors. So for protocol, these are just guidelines, 50 mg of nattokinase and 20 mg of lumbrokinase. While I'm saying here it's for chronic strep throat and autism, it is also true for most other autoimmune conditions. Okay, that's just a starting guideline, and half that dose if you're treating children below 12 years old. Okay, proteases, that is trypsin, chymotrypsin, and bromelain, papain, those things, okay? And plasmin and streptokinase are also good biofilm disruptors. N-acetylcysteine is very effective against biofilm. So, and it's a very simple thing, it's easily available, and it can be taken for prolonged periods of time with no adverse reactions. So it is something that you can use on a regular basis. Okay, coconut oil, which contains lauricidin, is also a very good biofilm disruptor. It can be used internally and externally, topically. Okay, or in very extreme cases, instead of using coconut oil, we use medium chain triglycerides, which is like a more concentrated form. Okay, colloidal silver works very well as a biofilm disruptor, especially when used topically. But what we would like to do is to use it both topically and ingest it so that you attack the pathogens from inside and from outside. So what was step one? Disrupt the biofilm, remove the defense. So what's step two? No, attack the pathogens. They're still alive. There's no debris. They're still alive. They're crawling around, right? So you need to attack them. Again, mercifully, we have a whole bunch of choices, none of which are drug-based. Isn't that a beautiful thing? Okay, so here's a whole bunch of choices. Many of these are available in India, and some of them that are not available are easily available online. Berberine, artemisinin, citrus seed extract, black walnut husk, echinacea. Ozone. I didn't put in ozone because it's evident. Ozone is all over the place. Okay, so D-mannose now is also available in India as a urinary tract infection product called tract-free, but it can be used for other things. They have D-mannose? Oh, beautiful. Okay. While we're on the subject of D-mannose, I want to tell you something really exciting. Just like we talk about nutritional supplements and everything, there's a whole world of therapeutic benefits from sugar-based molecules. D-mannose is a simple sugar. So this whole branch of medicine is called glyconutrients. Like you have xylitol, mannose, and stuff like that. So maybe in a future session, we'll talk about glyconutrients because they are very simple with no adverse reactions, and they can be used for long periods of time to treat major ailments. Okay, so what's step number 2? Huh? Attack the bacteria. What was step number 1? Okay, everybody passes. Okay, what's step number 3, Dr. Jignasha? What is contained in the debris? Can you tell me? Broken down biofilm, right? That's the first thing. Second thing is? Yeah? Okay, good, good, good. And also remember, the heavy metals that may be in the biofilm are now floating around. You need to get them out. So Dr. Denny just talked about it. So what's one way of getting rid of the heavy metals? Yes. And what else? Chelation. NAC. He goes to the top of the class. Okay. So step number 3. Step number 3. Mop up leftover matrix, DNA, and minerals. Okay, so you need binders. Again, Dr. Lenny also spoke about binders. I want to talk a little bit about binders. EDTA is a good binder. Chitosan, which is from shellfish. Remember, when you use chitosan, just make sure the patient is not allergic to shellfish. You have to make sure, okay? Other than that, it's fine. Citrus pectin. What works better is modified citrus pectin. Okay, MCP, or male chauvinist pig. Sorry, I couldn't resist that. But anyway, modified citrus pectin, okay? Now comes, at this stage, if you introduce pre and probiotics, it will work. If you introduce it earlier on, it will not work because it cannot penetrate the biofilm. Okay, so what the hell is that? Oh, okay, okay. Okay, so a special note on prebiotics. Soluble fiber that promote growth of helpful bacteria in the colon enhances GI and systemic infection. Remember one thing. Remember I told you in the gut, particularly in the gut, some biofilm colonies are actually beneficial for us. Some are disruptive, some are beneficial. The problem is we can't tell the difference between the two. So because we can't tell the difference between the two, let us not get frustrated. Let's destroy all of them and only create the desirable biofilm community. How do we do that? Is with potato starch, inulin, fructooligosaccharides, and beta-glucan. All these things are available, like in fruits, for example, certain vegetables. Although avocado, we can argue whether it's a fruit or a vegetable, things like that. But a lot of fruits contain many of these things, So what I would suggest is if you suspect you're dealing with biofilm, which is about 80% of the time, coming out of the treatment, once you do these 3 steps, it'll be a good idea to put the patient on a primarily fruit-based diet for about 10 days. So what does that mean? That out of the 3 principal meals in the day, 2 of them should be fruit-based and 1 of them should be vegetable-based without grains, for about 10 days. So that makes sure that they're getting all the prebiotics. And what's the benefit of that? See, remember, when you memorize the protocol and without understanding, it won't make sense. Why do we have to do that? Let's see if we can understand it. Yes, the reason is because in the gut, there are bad biofilm colonies, but there are also good biofilm colonies. But since we cannot distinguish between the two, we have to destroy both of them with our 3-step treatment. Once we destroy that, we want to replace only the good colony. And therefore, you need to do that prebiotic process. Clear? Okay. So let us summarize. what did we talk about so far? Summary? Huh? Wait. Yes? No. First, what is biofilm? Huh? First, what is biofilm? Biofilm is a protective mechanism that pathogens create to protect themselves from the immune system, okay, and to colonize. Okay, in other words, they're building a home for themselves so that they can live as a community, sharing nutrients, DNA, and everything, and at the same time protect themselves from the host immune system. Okay, so that's the biofilm. And because of that, most treatments don't work. Whether it's this thing, bacteria or virus or thing, okay, they don't work. So we need to break that in order to get to them. Now, the three steps. Right? How many of you are going to try it when you go back to your practices? Really? Yeah? So how will I know that you're actually going to do it? Okay. Send me a WhatsApp message. Don't call me, please, because I may not be able to pick up. Okay, wait. Chalo jaldi, wait a minute. See, nobody caught one important thing. What did I say in the beginning? The purpose of this lecture. What is biofilm? How to treat it, and yes, we haven't talked about that. See, everyone is asleep. We haven't talked about that. That's a very important thing because, see, so far what we've talked about will give you success, but it's not lasting success. Right? So, if you want, you can give steroids, you'll get temporary success. It's much simpler, right? Just prescribe hydrocortisone or Visolone or something, and you'll get temporary success. But the idea is like the difference between a good doctor and a great doctor is somebody who gets lasting results, right? So I always tell my patients, I consider my treatment for you a success if I see you walking down the street and you come and see me as a friend, not as a patient. Okay, so this last step is very important. Okay, how to prevent the recurrence. Okay, so why did the biofilms grow in the first place? We need to know that to prevent the recurrence. Okay, so this thing, alpha melanocyte stimulating hormone, okay, is our natural defense against biofilms. The body has a mechanism to prevent the formation of biofilms. People, most of us, 80%, have biofilms because the alpha MSH hormone is low. Just like you have a hypothyroid condition, you can have a low alpha MSH, melanocyte stimulating hormone thing. Okay, one way you can treat it is it can be measured. By the way, it's not available in India, but I'm trying to get some labs to do it. But in the US, it's freely available. You can test plasma levels of alpha MSH. But here, what you need to do is you have to assume it's low, and you can treat it by boosting ACTH. So one of the easiest ways is our wonderful Ayurvedic herb called ashwagandha and gugulu. These two things are very good in promoting higher levels of alpha melanocyte stimulating hormones. Okay, so first reason is biofilms form in people because their alpha melanocyte stimulating hormone levels are low. So you need to boost that to prevent a recurrence. Number two, salicylates encourage biofilm growth. Salicylic acid and salicylates in our diet, most of us have very high salicylate diets. Okay, so the way to prevent recurrence is to start eating a diet that's low in salicylate and eat other foods that are low in salicylate. Okay, so what are those? Okay, these are high salicylate foods. Avocado, apples, melon, so forth. Spinach, sweet potato, broccoli, cucumber. So you want to limit these things. I want for. You want to limit those foods. And you want to increase the low salicylate foods, which are bananas, pears, cabbage. Huh? This is limit. I didn't say cut it out. I said limit it. And that also you don't have to do for a long period of time. Now after, yeah. Please go ahead. Okay. So, what was this all about? Is to prevent the recurrence. Prevent the recurrence is to reduce the amount of salicylates in your diet, okay, by avoiding certain foods and increasing certain foods. Clear? Yes, sir. Okay. Okay. The failure of traditional treatment makes it important for us to recognize biofilms as factors in many diseases and properly treat stubborn infections and illnesses. I think if you follow these 4 simple steps that we talked about, disrupting the biofilm, attacking the pathogens, removing the debris, and preventing recurrence, you will find that this process is involved in most of the cases you see, regardless of what it is, whether it's autoimmune disorders or simple infections or major diseases like cancer and diabetes, non-healing ulcers and diabetics and stuff like that. It can make a big difference in the results you get compared to what you've been doing so far, and far less frustration from the disease coming back. Thank you very much.
Thank you, Dr. Suresh. That was wonderful. And I think, since morning, whatever we are listening, I think the gut is most important. And after COVID vaccines, I think the gut becomes all the more important. And we are getting a solution, and biofilm, I think, along with ozone, it should work. Along with vitamin D, it should work. Along with vitamin C, it should work. The whole integration is important. So thank you for bringing this to us, Dr. Suresh. Now I request Dr. Karthikeyan and Dr. Emilia to come forward. Dr. Suresh, I want you to be here.